So in this video we will tell about the electrocardiograph ECG. It is very important topic and we will explain so much so strong and so much easy. Okay, so ECG mean E electro and C mean cardio and G mean graphy. So by using electricity you see the heart. Graphy means see, cardio mean heart. Okay, so first of all by electrical conduction you see the heart. Okay, the heart activity. This is just like ECG, and you in this video we will complete from the basic to the advanced everything about the ECG. So first of all, there is the cardiac conduction velocity. For example, this is your heart. So how the SA node fire and how the velocity goes on and how the heart contract. We will tell about it. Okay, conduction velocity. Okay, one is the introduction. Another second we will tell about the depolarization wave, and another is the conduction velocity. So first of all, velocity of depolarization through myocardium. Okay, that is actually 220 millisecond they move through from this area to the first of all SA node fire. SA node is automatically after some time they fire automatically. Okay, and after that when it fire they give they due to them the velocity and the conduction and the depolarization goes toward the atria and all the atria contract, and after that it go to the AV node. Here is the AV node present, and after the AV node the velocity and the depolarization move through the bundle of His. This is the bundle of His. Okay, and here is the Purkinje. Now this is the bundle of His. This is the Purkinje fibers. Okay, this is the Purkinje fibers. Go to the Purkinje fiber, and from Purkinje fiber go to the ventricle, and ventricle contract. Okay, this is now simple thing. Now how it moved? For example, first of all there is a sodium channel HCN, hyperactive channel. Okay, we will explain that. There is a sodium channel, so sodium move inside. When sodium move inside, okay, so this area become depolarized. When this area depolarize or this polarized, okay, this area become depolarized and after that when it depolarize, the signal and depolarization move through this area by gap junction. Each cell have a gap junction, and they give signal to this area, and this area also depolarize. The sodium channel become open and the sodium move inside and become depolarized, and after the signal go to another cell and they also become depolarized, sodium ion move inside. Okay, so this is called gap junction. Actually increase the speed of depolarization of the wave. Okay, now let's tell about the conduction velocity. Conduction velocity is present atria have 1 millisecond. Okay, and AV node is actually 0.01 to 0.05 millisecond. Allow atria time to conduct. First of all, you have atria that is 1 millisecond. In 1 millisecond, atria can atria contract. Okay, and after that when the signal goes toward the AV node, in the AV node it actually take long time. It actually take long time. It actually take long time, and that's why it actually take long time. Okay, in AV node it actually take long time, and their speed is 0.01 to 0.05 milliseconds. Speed is so much slow. Okay, after it go toward the bundle of Purkinje fiber, and here it move fast. Okay, it is very fast. Okay, so if anyone asks from you that where the speed of the conduction is velocity is high, so that is the bundle of His and Purkinje fibers. Okay, now after that the signal goes to the ventricle and ventricle contract. Okay, and that is about 1 millisecond. Velocity is 1 millisecond. So now you have to remember that all the time is 220 millisecond. Okay, and 220 millisecond and 100 millisecond are actually taken in the AV node. You have to remember this. And now you have to, there are 0.22 second. So in 0.22 second there is 0.1 second in the AV node and 0.12 second in the atrioventricle Purkinje fiber. Okay, now come here to the electrical conduction in the conduction. Okay, for example in the heart, electrical conduction in the heart. For example, this is the HCN channel. HCN channel, actually when the HCN channel activated, hyperactive hyperactive sodium channel. Okay, so the sodium move inside, and this is actually the pacemaker. 1% of the cell of the heart. If the heart have 100 cell, 1% is the SA node. 1% cell are SA node. Okay, it is automatic continuous generate electrical potential. Okay, so when the HCN activated, they become depolarized, and due to this the other signal goes to the next cell. Okay, this is the myocyte, and this is the pacemaker. This is not a myocyte, this is the actually SA node cell. Okay, now good signal go toward the myocyte, and myocyte in the myocyte by the gap junction, this signal contribute to all cell, and by one time all the atria contract, and this is called sensation. When the at one time this all the cell contract at the same time, that is called sensation, because they have a gap junction, and due to this gap junction they contract. Make up of myocardium. Now another thing is the we will tell about the action potential. Action potential initiated by depolarization, more negative outside than inside. For example, actually inside are this is resting state. Okay, polarized state are resting state. At resting state, the inside is negative, but at depolarized, when depolarization happen, the inside still become positive. This is actually action potential. Okay, and by this way, this action potential move along the myocyte to the next cell. Polarization is more positive ion outside, it is polarized. Depolarization is initiated by the action potential is initiated by depolarization. Okay. Now, where this is the polarized state, and polarized state positive is more inside, outside, and negative is more inside. This is polarized and resting state. Now come here and see here pacemaker is in the SA node. There are SA node. Okay, and you have to know that from the SA node, the first of all SA node fire. Okay, and from the SA node the conduction and the signal goes to the atrial internodal tract. For example, this is the atria, and atria, when the SA node fire, atria have, this is large atria now, so the signal contribute in the atria, distribute in the atria to atrial internodal tract. Okay, that is also called Batchman bundles. Batchman bundles, you have to remember Batchman bundles. Connect SA to the lift atrium, it connect. Batchman bundle is actually connection between the lift. For example, lift atria, this is right atria, this is lift. The connection between them is called Batchman bundle. Okay, now during each heartbeat, for now second thing after that goes to the uh, bundle of his. After from the bundle of his, there goes to the per bundle branches, left bundle branch, right bundle branch, and after that there goes to the Purkinje fibers. Okay, so during each heartbeat, one cell first depolarize, not always same. In depolarization, first cell depolarize, but it is not important that actually that cell always depolarize first. Okay, all are autonomic. For example, SA node have 20 cell, so first there are one cell depolarized. It is not important that always that one cell become depolarized. Okay, now SA node SA node. Okay, from the SA node signal goes toward the AV node, and from the AV node actually velocity decrease the velocity of conduction. Why? Because of smaller diameter, AV node have smaller diameter. Okay, smaller ion channel, because it have smaller ion channel, delay in the circuit for ventricular filling. Actually, for example, AV node decrease the velocity of conduction, due to which more blood, their time is given to the ventricle to become fulfilled, and in that time the ventricle fill, and after when the AV signal goes to the the ventricle contract, and more of blood is stored in the ventricle. If this time is less, so when no more blood is going to the ventricle, and less blood is present in the ventricle, and less blood is move out from the ventricle. Okay, so it is important. If the velocity is increased, what will happen? Ventricular filling become decreased, ventricle filling become decreased. Another is the stroke volume is decreased, or cardiac output is also decreased. So these are the things. Now on the point that allow atria from the atria to the ventricle, Okay, this is the actually AV node is the only point that gives for example, this is atria, this is ventricle. They are separate chamber from each other, but AV node give connection between them. Okay, now after that the signal go to the Purkinje fiber are fast. They are so fast. You have to remember this. Heart contract in the coordinated way. For example, if one silk depolarize, all the cell of the ventricle become depolarized and the ventricle contract at simultaneously. Okay, giving forceful push. For example, if all the muscle contract at one time, this create a forceful. This create a forceful contraction. Okay. Now there is SA node. This is for example SA node. It is actually pacemaker. Okay, firing it first fire. After that, if for example if SA node don't work well, so what is the second option for them? Second option is plan B is actually AV node. SA node is actually plan A that is beating at 60 to 100 beat per minute. Okay, if the if the SA node is not working, the plan B is, what is the plan B? Plan B is actually the atrial nodal tract. Atrial nodal, for example, this is the atrial nodal tract. This is plan B. That is actually 60 to 80 beat per minute. If the SA node is not firing and atrial nodal tract is firing, it will be 60 to 80 beat per minute. Okay. If it is not working, the second thing is the second autonomicity is the C. What C? C is actually AV node. Then AV node will fire and AV node is actually 40 to 60 beat per minute. Okay. If AV node is not working, what will happen? Ventricle fire at 20 to 40 beat per minute. 40 beat per minute. So you have to know this. This is actually if SA node is not firing, the other planes are also working. Plane A, B, C, D. Okay. If A, if A for example fail, B fail, then C. If C fail, then D. These all are things. Okay. Now, what is the ECG basics? Electrocardiogram basics. Okay, we will explain the electrocardiogram basics.